misinformation is contributing to effective measures and waging victorious war against coronavirus? How is the misinformation in other places as well harming the war and neutralizing the fight nationwide and worldwide? Thank you, Nora.
Thank you, Alicia. This is a global problem, and we are all dependent on each other. So if, let's say, UK comes off containment and everything is controlled, we cannot say we don't care what's happening in the Middle East or in Africa or in the US, because the virus could be imported back and we'll have our second or third wave of epidemic. So, and this requires a collaboration between everyone. There's a collaboration between the scientists, collaboration between the clinicians to share their experiences, collaboration between the governments to share their data openly and timely. Unfortunately, these are happening. For example, we've seen in China share their genetic profile of the virus early on, beginning of January. And this had made it possible to start working on vaccines development early from February. We see the data. This is how we know how many people the worldwide WHO is collating, Johns Hopkins are collating. Therefore, we do have information collectively all we have come together to share this data together, and this has helped in the fight. We know from East Asian countries that actually the social distancing works, and this is why we have adopted these measures, because we know from the experience of others. Now, this issue of sharing is not only between countries, but also within countries. If we give consistent messages and we don't downplay the severity of the illness, not saying, for example, it's just a flu, then we will get people to work all together and to believe the messages, to get trust in the government, and we're able more likely to adhere with the recommendations, and more likely we can work together and to overcome this problem. This is a problem for every one of us, every individual, every nation. We can't get it over unless we all, each individual and each country, collaborates.
I could not agree more. Thank you very much, Nora. The next question is, in the existing global situation, how successful has Armenia been in fighting against COVID-19? So I'll take a stab at the answer. Armenia has confirmed their first case on 1st of March this year, and then mid-March, the government announces some measures like closing schools, closing universities, travel bans, and banning gatherings. So the Ministry of Health has devised a strategy. They're well supported by the World Health Organization, by the World Bank, and of course by organizations from the diaspora such as ours in a coordinated response. So for example, if they needed more protective equipment for their doctors and nurses, people were able to ship these kind of things to them. At the moment, so today, 3rd May 2020, again, because everything changes so fast, they have around 2,400 cases. 35 deaths were reported to the surveillance system of the country. And in the last few days, if you look at the daily number of cases, it looks like there might be an increase in the number of cases. So we'll have to watch this space to better understand what is happening. So again, as Prof. Nora said, it's very early to say what has been successful or not. A lot of this information will have to come in the months and the years later. So we try to do our best based on experience. We try not to compare different countries and say, oh, this one is better than the other, but it's really important to work together and to share lessons learned. So the next question, and I also realized that we don't have a lot of time left, but there's still lots of questions coming, which is great. The next one is for Prof. Nora, please. So Nora, do you think we are really approaching the peak, or will or will not the situation be flattened and arrive at a plateau?
Actually, the good news, we have passed the peak. Actually, if you look into the number, we probably had a peak at the Eastern time. So let's go into the epidemic curve. What is about the peak? We've heard a lot about it. So therefore, there is the first phase, which is an increase in number of cases. And this depends on two factors. The speed of the transmission. We look into how long, therefore, it takes for the number of cases to double, which is called the doubling time. And the second factor is the force of transmission, which is we measure it, we've heard a lot about this R, or reproductive number. So when this number R, it gets above 1, there is an exponential increase in number of cases. In the beginning, therefore, we had a doubling time of around every 3 days, and the reproductive number was around 3, which means one person can infect on average 3 other people, and 3 will infect 9 and 27 and 81 and so forth. So the numbers are increasing highly. But then when we have these control measures, for example, the most social distancing, the virus doesn't have a chance to jump from one person to another. So which means, therefore, the transmission is reducing. And when the transmission, the R, gets into less than 1, we start to get below the curve. We're coming down the curve. And now currently the figures are R is less than 1. Exactly, we don't know because we're not testing to see the exact number, but it's going to be around 0.6, 0.9 or whatsoever. So basically, if you have an R less than 1, which means if you have 100 cases, the 100 will transmit into 50, 50 to 25 to 12.5 and so forth, which means this will get into the containment of the infection, and eventually the virus could fade. But very important, this is not a fixed event. It is not necessarily it will happen in the order that we say. This happens because of the measures taken, not giving a chance for the virus to transmit, to jump from one person to the other by adhering to a strict social or physical distancing measures. So if we relax these measures, there's a risk that the virus could pick up again, and the R number can go above 1, which means we start another curve, exponential growth. Continue with this, we're in the right trajectory, I can say, therefore we're getting down.
Brilliant, thank you, Nora. So the next question is, how far are we from the COVID-19 vaccine and its mass distribution, as we know this is the final solution and the end of this pandemic? So first, I do want to say that a vaccine would be part of the solution for this pandemic, but that would be in addition to all the other things that are happening. So exactly what Prof. Nora mentioned, there are so many interventions that are being put in place, and we have to make sure that all these are followed. So if you may be aware that, for example, so there's not a lot of infections that we were able to get rid of with vaccination, and the only human one is smallpox. So we have to be very careful and be cautiously optimistic about what can and what cannot happen in these very early stages. So a vaccine usually takes many, many years to develop, to test, make sure it's safe in people, make sure it actually works. Does it work in sick people, not only in people who are healthy and have the virus, and then to distribute it, to manufacture it in very massive ways and then distribute it. And as you know, we are already struggling with a lot of other vaccines that we know are essential for a good and healthy human life. So the record for developing and distributing a vaccine, the record for developing the vaccine is 4 years. This is the fastest we have ever done for any vaccine, and this is for months. Ebola was another short one, which was 5 years. And I know there's been a lot of very good stories in this pandemic. A lot of, for example, the development of the test was very quick. As Prof. Nora mentioned, the fact that the genome was shared so quickly, there's been excellent news. And there are already more than 100 vaccine candidates for this virus. But at the same time, there's also people saying that, for example, at the end of next year, we will have tens of millions of doses. I think AstraZeneca and Oxford have promised this before the end of this year. And a lot of things are said also often we have to remember for political and financial reasons. So we have to be cautiously optimistic. I would say probably a bit more time, also making sure that the vaccine that is made available to us is safe and not causing more problems than actual solutions. So I'll take the next question, which is, why do Swiss doctors think it is okay for young children to now hug their grandparents, but all other countries do not? So we know it's really important for everyone's well-being to be around their families. So children want to be with their grandparents and their parents and vice versa. So it is really important to our life, but at the same time, we need to be cautious and not pass on the virus from one person to another. So in Switzerland, a study has recently suggested that the children could not pass on the disease because they don't have something called a receptor, which is what the virus would attach to stay in the human body and infect someone. So the study that this came out from is published in a journal that is called a preprint. So that's a journal that hasn't gone through all the checks and the monitoring that other journals usually do. So it's still preliminary findings. And to be honest, a lot of experts on this question do not agree with the solution. So in the UK, the government still asks people who are over the age of 70 because there are more risk for complications from the virus if they do catch it, to be as separate as possible. For example, if they live in the same household as their grandchildren, to sleep in different beds and to use a different bathroom. Again, it's not easy, but it's extremely important. So at this point, there is still not enough information about the role children play in passing the virus in the wider community. We know that when they catch the virus, they typically don't have a lot of symptoms or they don't have symptoms at all. But we're still learning a lot about whether they're able to pass it on to other people, and if so, how much that contributes to the transmission in the community as a whole. So we have to be cautious about this. Next question is for Prof. Nora, please. Why is the daily infections, hence hospital admissions count, still in the hundreds despite 6 weeks of lockdown? This is in the UK, presumably.
All right. So first to say that the number of deaths was much less than what we would have seen if we didn't have a lockdown situation. And also the number of deaths now reported are different from what we used to see a week ago, which is now they include in-hospital and out-of-hospital death. Now, why do we see still number of people are dying? One is to consider that there is a lag time period between the getting infection and dying. So the lag time period is around 3 to 4 weeks. So what we are seeing now is what has happened 3 to 4 weeks ago. Secondly, when we see reported numbers in the last 24 hours, they are not the number of deaths which have occurred in the past 24 hours. These are the number of deaths reported, which means some of the deaths have occurred a few days earlier, some of them a few weeks earlier even. So they are not a true reflection of what's happening yesterday. The numbers also, we need to consider that the lockdown is not complete. It's not 100%, as I've explained before. There is still where some people are going to work, and essential workers, which means there is still a virus in circulation. As long as there is a virus in circulation, there will be people who get infected, and some of them will have bad outcomes. But eventually, if we look into the number of admissions to hospital, and this is another indication that therefore we see that there is a drop in the number of admissions.
Seda, did you want to say something?
Yes, thank you. Are you taking the next question? Is yours?
Yes, the next question is, why are the UK citizens flying back from abroad not being quarantined? Is that right?
Yes.
Brilliant. So for that one, so people who are traveling or returning to the UK are asked to stay home like everyone else. So they're asked when they reach the airport to avoid public transportation to be able to go home. And if they are healthcare workers, they should not be in a hospital or in a GP surgery or anywhere where they would see patients for 2 weeks. So there's more information on the gov.uk website. But this is a much more sustainable way to quarantine as opposed to having people in a separate place, like, for example, a hotel or other countries have done things like this, and we've seen there's been some really harmful effects coming out of this. The safest way for the UK has been to keep people at home if they have a safe home. The next question is, if over 90% of those in mortal danger are the elderly, the obese, and those with underlying conditions, why is everyone else, i.e. the young, fit, and healthy, also in lockdown? So this is because the virus spreads from person to person. So the young, fit, and healthy, they can still have the virus. They will not necessarily have symptoms. They could have mild symptoms, but whether they have symptoms or not, they will still be able to pass it on to other people. So it's extremely important that everyone please stay at home. That way they protect not only the most vulnerable people who are at more risk to have very complicated illness and perhaps die from it, but also to protect themselves, because we've also seen that there's been young people who were healthy and never had a problem before, contract the virus, in some cases have very bad illness, and in some very rare cases die. So it's very important, please, that everyone stays at home, except if there are key workers and the exceptions that we have from gov.uk. Then the next question is for Dr. Seda, please. It's a long question, so I'm just going to summarize, if that's okay, in interest of time. We only have just 5 minutes left to 4 o'clock. This is about a recently retired nurse who is Armenian in her mid-60s, and the family member is asking whether there is any evidence of disproportionate risk to Armenians on the front line.
This is a very good question. However, there's no very short, simple answer for it. The age concern is 60 in this case. However, there is not known that Armenians in the front line are much higher risk than the others. However, this person, if there is any other underlying risk problem, health problem, it is extremely important to take all sorts of caution. However, now, although NHS announced that to bring or to call all the retired nurses and doctors to work for NHS, some of them for frontline, some of them not, and depends on this person's previous nursing skill or medical skill. NHS, it's very good to locate them in the proper places. And availability or providing the personal protection, nowadays it's good. So there is another good factor. However, it is very important, if there is any underlying risk factor, to declare beforehand to NHS authorities so that they know where to locate this sort of returnee doctors or nurses. I am not aware of Armenians are in the BME group. However, they are still too early. The others, the ethnic minorities who had a high proportion of mortality and morbidity in this COVID-19 outbreak, they are those who had underlying medical problem, and those who are also had maybe other factors which we don't know, genetics, socioeconomic. So many factors are there. So the short answer is, I think the person should assess his underlying health problem very carefully, take every precaution for PPE, and be clear with NHS authorities of his or her ability in order to go to the front line or to work in the back line. Okay, I hope this is a satisfactory answer, but we will have more outcome, maybe in few more answers in few months' time.
That was great, Dr. Seda. Actually, your sound is back. So would you like to ask the next question to Nora? It might be our last question as we're running out of time.
About the masks, whether we should mask, the controversies about masks and hand gel, whether it's antibacterial versus antivirals hand gels, and whether to wear masks or not to wear masks.
Hi, thanks. Therefore, I'll start with the mask. So therefore, while still England and Public Health England are contemplating whether to use masks or not, therefore, we have Scotland, whose recommendation is to the public is wear facial covering when you're going for groceries or using the bus. So the same is with the US Center for Disease Control has similar recommendations. Now, there is some evidence that wearing masks can protect others. And this is because people who have the infection 2 to 3 days before the infection, they can shed the virus or can spread the virus to others. And also there could be people who have the infection but have no symptoms or any noticeable symptoms. And these are the ones by just, they can pass the virus to others. And the virus can pass from not only sneezing and coughing, but also from speaking and just breathing. So the idea is if everyone wears the mask for just in case they were infected, had the infection, we will have some reduction in the spread of the virus if everybody does so. But in addition to this benefit, there are other considerations that we need to take into account to make sure that we will get the benefits of wearing masks. One consideration is therefore using the mask and how you use your hands. For we know that one of the routes of transmission is having your hand touching a surface which could be contaminated and getting it to your face, your nose, your mouth, and possibly through your eyes. Now, if you're not used to wearing mask, maybe at the beginning, you would be using your hands a lot to adjust the mask, which means that if you're the one who don't have the infection and you're wearing it just in case, you might increase your risk of passing the infection to yourself. So it's very important when wearing mask, we control our hands as we are without mask, therefore, and we wear the mask properly, which means you hold the mask, therefore you wash your hands before wearing, you don't touch the surface or the front of your mask with your hands rather than from the ear loops, you put it on. When you remove your mask, you put it carefully without touching it and also wash your hands. Now, the second consideration is that people may get the false reassurance of false security, that they are wearing masks means they can ignore some of the physical distancing recommendations, or just because they have to come closer to other people in order to understand the conversation, which means we get an effective method of physical distancing, we will compromise that, which increases one's risk of having the infection. And a third factor to consider is that actually we are short of masks. If people are going to compete and go and buy the surgical mask, we will get into a much bigger problem by depriving all those who actually need, those in the front line, the mask. So this is why what we need to do is to have not the surgical mask. There's evidence that if we have masks which are homemade or made of cloth, they are almost as effective as wearing surgical masks. So if we take into consideration of these three factors, then wearing masks on a population level could have some impact in protecting others, therefore reducing the transmission of the virus. Now, coming to the question of disinfectants, yes, all what we need a disinfectant is soap and water, as simple as that, because soap can dissolve the lipid or the fat surrounding the virus. It basically disrupts the virus. It's very effective and solves the problem. If you don't have access to soap and water, if you're out, a disinfectant with alcohol based, a 65% alcohol will do the job. We don't need more than that. Therefore, if you want to use for cleaning surfaces, yes, alcohol-based or bleach would do. But provided all these are used on external surfaces only, please.
Thank you, Nora. The next question I'm taking is the people are asking, what should I do if I'm worried that I might have coronavirus and I'm caring somebody at home? Not a carer in care home, but at home, or be a sort of key worker. I mean, this is a simple answer. I think what you should do if you are suspect that you have the symptoms or anybody in the household has the symptoms of any type of whether mild, moderate, or severe coronavirus, just dial NHS 111 and go into the option of COVID virus service. And then there will be question asked, you answer the questions, and they will direct you to the correct services. Okay, so there are several doctors sitting there, check your symptoms, and they advise you what to do, either to isolate yourself 7 days, or to isolate 14 days, or to go and have tests done, or how to sort out your problem. But please use the COVID-19 NHS 111 service. Okay, now I will take the next question, which is also related to this, which is about shall I contact my GP if I have got any other problem other than viruses or other than coronavirus? The GP services is open, the practice is open, and the telephone line is there. As usual, you could ring and you make appointment. You can then the GP rings you back, or they can do it immediately at the same time, either telephone appointment or online appointment, chat to you online, or they could do video appointment. They can also call you to do face-to-face appointment. If it is suspected to be coronavirus or you have symptoms of coronavirus, yes, there are special places we call hub. where they could see you there, several doctors sitting there and welcoming patients, and they have full protection both for yourself and for them, and put you into right direction. Now, for routine services of GP practice, for immunization, for flu jab, for pneumonia jab, or for blood tests, or injections, or for any other cancer services, if you suspect you have got lump in the breast, or suspect you have got some nasty mole on your skin, lesion, and you need an urgent GP appointment, please, we are all sitting there, they're all waiting, and they can make a telephone call, or you can attend with the appointment, and they will search you out, they will refer you. All the referral systems are open as usual. Now, there are certain services for children immunization or any injections, or certain small services where they can actually do it in the car park of the GP practice without going inside the building. So don't hesitate, the line is there and you can go if you have any problem. Okay, thank you. Now, the next question that we have, Nora, is we talked about tracing and tracking. Whether this new drug, which is, well, I can talk about this one, or you can compliment girls if you want, about the new drug, which is now in trial in America, and Trump is talking about, remdesivir. However, this is still in a trial. There is, in this country also, several hospitals are participating. It is not a valid outcome or any effective treatment, or we can say yes, this drug is okay at this stage. It is still under trial currently. Any other question? Because as we run out the time, I'm just trying to wrap up all the questions which is valid to answer.
There was one question, Seda, about smoking, and is that?
Yes, we talked about that one. Whether smoking is a hurdle or is a risk or is a benefit. Who would like to tackle that question? Nora, you like to answer, or you want? I can talk if you want me to.
So I think this controversy started with a study published in France a few days ago. It's a small study, observational, in one hospital in 1 month's time. They've looked into the 350 patients admitted, and they've looked what proportion of them are smokers, and they compared it to the national average number of smokers in France. And accordingly, they said there's less number of smokers in the group admitted. But this is a weak study. There are several weaknesses, and this is not generalizable without knowing who they are, what their characteristics, and what they are comparing. So I will not take this study as a value to say smoking is a protective against corona. So not. What we know is as smoking, therefore it causes lung problems. Therefore, we all know about the lung problems that comes with smoking. And we know that lung problems, having a lung condition, is a risk factor to having severity of illness and having the complications. So as such, smoking is a risk factor for to have a bad outcome. In addition, the process of smoking, therefore people are getting their hands to their mouths, therefore, and having inhaling, therefore they are increasing the risk of having for contamination or inhaling or getting the virus. So it's another risk factor. So in all aspects, the recommendation is stop the smoking if you therefore don't smoke, therefore to protect you from corona infection and the complications, and to protect your lives. Recommendations still the same. Smoking is bad.
Thank you, Nora. Yes, smoking is always bad. Please, it has effect on the other ways of the lung diseases, or not only lung, every single organ in the body. This question, Nora, which you answered before about the tracking, tracing, whether it is and the data security. Would you like to answer the questions? Somebody is asking whether it is there any data security for tracking, tracing of the testing, tracking, and tracing of the virus.
As I've alluded to it in the previous question, so there will be, for this app is a voluntary way of getting, there will be consenting for this data to be used for the purpose of contact tracing, for the purpose of controlling the epidemic, and it will be of a time-limited factor. So of course, the people would know what you were doing during this period of time, but this information is only used for the public good, is to prevent you and others from having the infection, and therefore we are taking the compromise, the trade-offs. Therefore, if we don't do this approach, then we have to continue with a population level lockdown, and who knows for how long. And this would be compromises there's our well-being from all aspects, physical and emotional. There's an economic downturn, and this comes also with a cost on health. So we have to trust, as we trust the government to say, tell us, go stay at home, we're staying. We know for a good purpose. Similarly, we're trusting them with this app to be used for the purpose used for a limited period of time.
Thank you, Nora. This question is quite interesting. Somebody is asking whether the work is been doing on testing the coronavirus at Imperial College, leading by Professor Lord Darcy, is whether we are sharing with international Armenians or our Armenian colleagues in Armenia. The answer to this question, yes. First of all, Lord Darcy himself has got very good connection with the Ministry of Health in Armenia, and with us as general, and we, International Armenian Medical Association, AMIC, we meet once a week, every Sunday at 6 o'clock, actually in a couple of hours time, and also several other colleagues from the Department of Health and other specialists from Armenia, where we're sharing all the advances and updates or what's going on nationally or internationally with each other. So the answer to that question, yes. So hopefully whatever we're doing here will reach to Armenia and will be there soon. There is another question here about whether how to differentiate between hay fever symptoms and the symptoms of coronavirus, of somebody is getting more or less similar. However, the simple answer of that question is hay fever symptom is somebody gets hay fever, they get it every year, and they know exactly what symptoms they get. So if it is something different, if it is different type of cough or different type of short of breath or sneeze, it might be sensible to ring 111 thinking about could be COVID virus. But if it is seasonal, which is happening in the sunny days, in the high pollen season, then it will be certainly recurring of that person's hay fever. And it is important to see that the COVID virus is in the hot season, it's better, while hay fever is opposite. So these sort of factors one has to be consider when differentiating between hay fever and COVID virus. And whether flu vaccination it's the, Nora, do you like to answer, or Alicia like to answer that question, whether flu vaccination is not given in those allergic to certain antibiotic or food like egg? Could any allergy predispose COVID-19 or increase severity?
So I'm not sure I heard the whole answer, the whole question, but there used to be some formulation of flu vaccines where people with egg allergies were not able to take them, but that has changed now. So having an allergy should not prevent you from having a flu jab, and please do get your flu jab every year, because even though it will not directly protect you, for example, from coronavirus, If you have coronavirus and the flu, and this has already happened, you're probably going to be much more sick than just one of these two viruses at the time. So please get all your different jabs, everything that you're supposed to have as you normally would. And the question was about any allergies and any influence on that for the coronavirus illness or vaccine. So for the illness at this point, there's no allergy that we know of that puts you at higher risk. And then for the vaccine, because we do not know which of the many candidates will be successful and the safest one, it's impossible to tell at this point. So we'll have to wait a bit more time before answering this. I doubt that this will be a problem because for most vaccines, there's not a lot of allergies that interact with this. Some of them are for old vaccines where they used to put some other types of antibiotics and things like this in the vaccine. That's no longer done as commonly as it was before. So let's wait and see, but probably not.
Good, thank you. And there is one more question, and perhaps you like to answer also. It's about the other type of infection when can reach the lung, like toxin. Here somebody is mentioning of PVL toxin for MRSA stuff, negative infection, which get into the lung, and that can cause a morbidity, heavy morbidity, white blood cells, and prevent recovery.
So it's true that in some other viral infections, for example, with flu, when you have flu, we know that some people also get bacterial infections after this. For example, they get pneumonia or a lung infection with bacteria, not viruses. So this is different. So they get it after a couple of weeks or so. Right now with this virus, we have not observed a lot of what we call a secondary or superimposed, meaning an additional infection with bacteria on top of the virus. So this has not been very common so far. Again, it's very early days and we're waiting for new information.
Good, thank you. And one more question left, if I'm right, which is it BCG vaccination offer protective effect on coronavirus outcome? Shall I answer that, Nora, or you would like to answer? There is only one study currently, which is, I mean, there is no randomized clinical trial for that to give a valid answer. However, WHO now is conducting a study, randomized clinical trial. Yes, Nora? And unless the results of that trial become available, we cannot say that yes, BCG vaccination will offer protective effect. However, it's very interesting in these BME patients who are having high mortality, relatively high mortality and morbidity in this country or in New York. They are all the children from ethnic minorities in this country. All the newborn babies are getting vaccinated by BCG. And we are all the ethnic people who would come from Middle East or from other places. We are all vaccinated BCG. So if that becomes true, that it is good sort of breakthrough information. What do you think, Nora?
So we need to wait the results of randomized controlled trials. It's good that there are many studies are underway. So hopefully one of them will come up with some positive results. So.
Good. Thank you so much. I think we have covered, girls, all the...
That's all right, Seda online. That was typed into the chat, if that's okay, and I'm happy to take. I just wanted to add to the BCG answer. I completely agree with both of you. I would say in addition that some of the studies that came out, again, were in these preprint publications, and it's very unclear whether the countries that vaccinate with BCG, what is really measured is, for example, the infrastructure of their public health system or other type of things, as opposed to this specific vaccine helping with this specific virus. So I think we all have to be a bit cautious about, there's a lot of information going out there. Some of it is correct, so please check the sites that you trust. There's a lot of things, for example, on Facebook and on social media that are not necessarily correct. So take a step back and try to make sense of some of this information. The question is, why are new patients not taken to Nightingale hospitals directly in order to keep regular hospitals open for other patients and free of COVID-19? referring to new cases, not those already ventilated, which I imagine would be difficult to move. So Melina, the answer to this is that it's extremely difficult to not separate, as in distinguish the people who have COVID versus the ones who do not. So there needs to be, for example, a healthcare worker being able to assess them. Sometimes this happens through 111, and then you're told to either go to the hospital for the test or stay at home if you're well enough. When you come to the hospital, there's some tests that are being done. There's always challenges with the test as well. And then when you come into the hospital, things can look a bit different. So even in the hospital, there could be people who came in who looked like they had something completely different from the typical COVID-19 symptoms. They happen, it's not common. Most people, like around 85% of people, when they have symptoms, their symptoms are a cough and a fever. But in a lower number of people, it's not exactly that thing. So it can be something else. And it's very difficult to say that these people have COVID-19. So if we take the risk to say this hospital is what we call clean, and this other hospital is called a hospital for COVID, you will probably get a little bit of how can you say, contamination, if you want, and there will always be some patients with COVID-19 who will be in the regular hospitals as well. Now, there are some very good, what we call infection control measures. So there's ways for the hospital to stop the spread of these infections, but that's also the reason why all healthcare workers have to know how to protect themselves and protect their patients, because we always have to keep we call that a high index of suspicion, or basically making sure we always think about COVID-19, even in people who do not look like they exactly have the typical picture of COVID-19 in the hospital and in GP surgeries.
Thank you, Alicia. Yeah. I think that's all. Is there any other in chat line? Any other questions? No,
it's not answered already.
No. But thank you so much. I hope we answered most of your questions. Undoubtedly, a few more have arrived in my box, where we will leave it for the next session. Thank you so much, Alicia, and thank you so much, Nora. And thank you for Armenian Community Emergency Management Team, Karnik and Armand, for organizing this. And as I said at the beginning of my introduction, that this is the first of several, hopefully in the future coming. We have preliminary booking in 2 weeks' time, 2 weeks today, on virology and viral aspects of coronavirus and how it's differ from Ebola, HIV, or other SARS or other viruses, by Dr. Berj Azadian, consultant microbiologist from Westminster and Hammersmith and Imperial College hospitals, or Imperial College microbiology department. However, I would like to invite you all to attend, and thank you very much for participating today in this question and answer session. Thank you all the attendee and participants. Thank you.
Thank you, everyone.